Hi everyone, it's Kristen and this is step 3 for weight loss surgery, pre-ops. So I did my first round of pre-ops on the 18th, and the first one I did was called an EKG. You go into your little EKG room and there's like a recliner. You lay down, they put the sticky things like on your chest, underneath your boobs, around your stomach. They just basically want to see how your lungs are doing and your heart. The test is super quick. It takes longer to stick the sticky things on. So there was an incident about that I wrote on my blog, but I don't want to vent about it. So next was labs. I used to have a bruise right here, but I don't know if you guys can see it. But the lady stuck me. Labs are real simple. They just take your blood. But the lady was horrible. She stuck me and bruised me. I'm never bruised. So she bruised me and stuck me, and it was horrible. Anyways, next was the ultrasound. The ultrasound, I carry all my weight in my midsection. I look like a peanut M&M. I have little legs, medium-sized arms, and a fairly tiny head. But this area is the peanut M&M. So it's really hard, I would imagine, for the poor woman to get, nice readings of my insides with all the fat. So when she was doing my spleen, it hurt like hell. I had bruises because she would tell me, okay, turn to your side, breathe in, and she'd push as hard as she could, and then she'd take a picture. And she did that to my spleen and my pancreas. So that hurt like hell. My sides hurt. I felt bruised, but I felt bad for the poor woman, like jumping on me. I'm here, this beached whale on this freaking hospital bed, and she's like trying to get readings off of me. So I felt bad for her, and I felt bad for myself, but I was thinking the whole time, like, I'm not gonna have to do this anymore. I don't have to worry about this. So she was nice too. She was cool. Last that day on the 18th was a chest x-ray. They give you this little belt thing that you have to wrap around yourself, and it has to hang off your butt. The belt thing didn't fit me, so I had to hold it behind me like that. I had to hold it behind me, and I was embarrassed. It was a dude doing it, so I was like, okay, whatever. So he took my chest x-ray or whatever, and then you have to do a side shot, and your elbows have to be up so that they get the side of your chest. Because the belt didn't fit me, he had to make a stand behind me out of the chair that was there. I was embarrassed. I was really embarrassed at that, but I was thinking, again, I won't have to do this, anymore. This is the last time I have to humiliate myself because of my weight at the doctor's office. So that is what I did for the 18th. My insurance did ask for a pre-op diet. My mom, thank God, made me go to my PCP last year and just do a diet, just start one, so that just in case they asked, and they did. And I did it for 8 months, so I have more than 6 months, and I'm submitting that next week. Okay, so on to, and for that, you just go, you weigh in once a month, and they ask you what you're doing, your exercise, stuff like that. Pretty simple. Last was my endoscopy yesterday. There's a little dot on my, right? Well, there's a little dot right there, and that's where they put my IV. Everybody at the place where I got it done, super nice people. They were just so nice. They knew my surgeon and the other surgeons that work with him, and it was just awesome. I told them, why are you here? And I'm like, I'm having bariatric surgery, and they were just so nice. It was not like the EKG chick that really pissed me off on the 18th. They were just so nice. So they were saying, that's great. It's good that you're having a handle on it. I mean, they were just really great. Went in. They had a bariatric gown for me. When I did my test on the 18th, I had to use 2 gowns. So they were thinking ahead. They didn't make me feel self-conscious. I told Dr. Patel, who did my endoscopy, I'm like, I saw a YouTube video on it, so I'm pretty good on it. And he's like, did it scare you? I'm like, no, because I'm asleep when you do it. So anyways, So they went, they checked me in, they put my IV in. The nurses were awesome, great. Dr. Patel came in, and my anesthesiologist, before they did the procedure, told me what was going to happen, did a quick overview. And they rolled me into the procedure room where they do it, and I saw the giant black snake. Like, I was like, oh my god. So I guess I started freaking out. So the anesthesiologist stuck something in me, and he was asking me questions about my appendix. And I was like, yeah, I was 16, and I was just telling him, yeah, I felt a little groggy when I woke up, and then all I remember is just closing my eyes, and then I woke up. So basically what they do for the endoscopy while I was asleep is they stick this big, long, like snaky tube down your throat, and at the end of it, there's a camera, and they put gel on it so that when you stick it down your throat, it slides in, and they just take a picture of your esophagus, your stomach, and right where your pylorus is, right when it gets into the small intestine. So they took pictures of that, and I have pictures of it. I should show you guys my pictures. Let me go grab my pictures. But that's what they do. They take pictures of your stomach. Let's see if I can get my little bag here. Where are my pictures? Oh, here it is. So let me go back here. Close the door. So I'm going to have some privacy. Okay. So what they do is they take pictures. So this is my insides. Ooh, sorry people. This is my insides. I don't know if you guys can see it. So those are my insides. And the one that says number 7, the hanger will point at it. That one right there. It's a little red, so they took a biopsy, but it's basically because I take pain meds. So he says there's nothing that he sees wrong. I'm healthy. I rarely drink. I don't smoke. So he said when the biopsy comes back, it's probably going to be fine. If it is something and then it has bacteria in it, it's 2-week delay, and I'm still cool on my schedule, meaning my deadline. But he says there's no worries because I had a really bad backache on Sunday, and I took 2 Motrins. So I'm trying not to take my NSAIDs, but it's hard because it's been cold in SoCal, and my legs every morning have been hurting, and I really can't take anything. So that's it. For the endoscopy, I woke up. I was woozy. My cousin was making fun of me because I was sort of like, you know, you feel fuzzy. I don't know, it's like when you get really drunk. That's how you feel. So that's it. I finished my pre-ops, and I was really excited. Next week I am submitting to insurance, probably midweek to the end of the week. So I am very, very happy. Just really excited. My sister is going to start her 6-month diet, and she says she's going to really try hard, and she'll probably be getting her sleep in the summertime. So I'm really proud of her because she's dedicating herself to this diet, that her supervised diet. She's dedicating herself, and she hasn't weighed herself yet, but she's only going to weigh herself when she goes for her weigh-in. So she's really dedicating herself, and I'm really proud of her. She has a really great mentality that she's going to get it. So I'm really happy for her. So that's it. Those were pre-ops, people. I don't know. I wasn't asked to do sleep apnea, so I can't really tell you guys. I would say watch other people's videos for that. But yeah, feel really good. Okay, so everyone take care, and I will see you guys soon. Hopefully with a really, really, really cool next video. Okay, take care. Bye.